Welcome to Season 3 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Josh Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former Secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, Stephanie Desmond talks to freelance science journalist Roxanne Kamsey about the challenges we face in communicating how to keep safe during the pandemic. Let's listen.
Roxanne Kamsey, thanks so much for joining me.
Thank you so much for having me, Stephanie.
So you are a freelance science writer who has covered the pandemic from the beginning, and you've written some really interesting stories. And so I'd like to sort of talk to you today about how we communicate about the pandemic. Something I wanted to talk to you about is sort of we talk about having science-based COVID prevention measures. And while things like, of course, mask wearing and hand washing are definitely backed by science, we have things that maybe aren't so backed by science that we're claiming are. Talk to me a little bit about that and maybe give me a few examples.
Yeah, I think what you're saying is really true, that there are some things that make a lot of sense scientifically. And then we have seen in this pandemic a couple occasions, or maybe more than a couple occasions, where public health officials or politicians have come forth with some policies to cope with COVID-19 that just have people scratching their heads a little bit. Like, for example, one thing that people in Spain were telling me is that they closed the parks, but they kept the restaurants open. And to folks who have been following how, the SARS-CoV-2 virus is potentially spread airborne, or it can be, and that indoor environments are more risky, that was a really puzzling example. And like another one that's a little bit more, two examples that are a little bit more out there is that South Africa wanted to ban people from doing too much shopping that was like not necessary in their wintertime. So they said you couldn't buy closed-toed shoes. I'm sorry, you couldn't buy open-toed shoes. Closed-toed shoes was fine, but they didn't want people getting sandals in the winter. They thought that would just encourage people to go out shopping unnecessarily, which, I mean, maybe so, but the science about whether that's really the most efficient policy to institute is unbeknownst to me. And the last one I'll mention is that here in Canada, where I am, the country's chief public health officer in September recommended that people, if they're going to have sex with partners that aren't people they live with, wear a mask. And it just made people kind of step back and say, is that really going to protect you if you're having sex with someone from getting COVID-19? So, it's like, as you said, like some of these policies, they don't really seem to be that evidence-based.
Mm-hmm. But even say, staying 6 feet apart, even that's not necessarily so science-backed, is it?
Yeah, I mean, like there's some science there, but it goes back decades and isn't really as precise maybe as we would hope it to be. Like the 6 foot rule has its origins way back in the 1930s with this guy, William Wells, who had kind of studied how far droplets go when you cough. And later on, after World War II, there were some experiments where scientists put people in like a apartment type situation together in an experimental setting. They called them like the honeymoon suites, and they would kind of observe how much one would transmit flu to the other. Later on, there were card games that people played in an experimental setting to see if somebody sitting at the card table would transmit to another person. And so from that, it was kind of assumed that it was a 3 foot distance that would be required. And then later on, more recently, with the swine flu outbreak and with the original SARS outbreak, they found out that actually 3 feet might not be enough distance based on looking, for example, at where people are seated on planes where they transmitted to one another. So the two rows apart, there was a transmission that seemed like 6 feet. I mean, the thing is it's a spectrum, and there are so many factors that could play into the 6 foot is a rule of thumb, but it's not the most scientific rule of thumb.
So do you think that, some of the messaging isn't really working, right? Where people are still not following guidelines. And so my question is, do you think that this odd mishmash of science-y rules, maybe that aren't so scientific, I mean, do you think that's helping to sort of confuse people? I mean, is that making people say, well, what is this nonsense? And so I'm not going to follow the rules.
I mean, I don't know about you. I found it really hard to keep up with the rules. They seem to change quite often. And, the pandemic situation changes quite often as well. So I grant that messaging will change to some degree. But I think that each locale seems to have its own approach. In life, it's lovely to have some things be bespoke. Like you would want a suit to be bespoke to you, or maybe a haircut or something like that. But I don't think that the tailoring of this to each individual location has really reflected kind of a consistency in approaches to science. Sometimes it feels like we're living in different worlds where different public health officials are looking at different data and making different decisions. And I think it's become exhausting for the public.
Mm-hmm. And it probably feeds into sort of this whole anti-science attitude that we are seeing.
I certainly don't think it helps. For sure, that's a concern of mine, 1,000%.
Yeah. Something else that you have written about, which is really interesting to me, is you wrote a piece called "The Pandemic Must Be Seen." Can you tell me about that piece?
Sure. Yeah. I mean, I at the same time that we're being bombarded with all these public health messages about, wash your hands, don't buy open-toed shoes or whatever, have sex with a mask, don't go to a bar after 10 p.m. or stuff like that. I think that in some sense, the pandemic's real effects are invisible or not discussed or not seen. And that is that, when you get this virus, if you are unfortunate enough to have it really hit you hard, it can feel, from what I've heard, like you are drowning on land because your lungs fill with liquid, and we take for granted every second of the day, even when we're asleep, the ability to breathe. And I do think that the very devastating effect of this virus's ability to steal away someone's ability to breathe and potentially their life, it just isn't shown on the TV. It isn't shown in public service announcements. It's not photographed that much because it's happening in hospitals where there's privacy laws and things like that. So yeah, I think we're living in a time of an invisible pandemic.
I think, even someone close to me said, well, I don't know anyone who's had it. So how bad could it really be? I mean, I know people who've had it. I know people who had mild cases who are very sick. But we don't see that at all.
Right. Yeah, no, I mean, I know people that have had it that also got very sick, but I mean, they didn't end up hospitalized. I should knock on wood for that. But I didn't even see them at their sickest because they were self-isolating. And,
right.
I could get a sense from their text messages that they really weren't doing well. And so I just feel like even those of us who do have people we know get sick, even family members who pass away, they're, FaceTiming for a second or two, or, it's all behind, the barrier of the hospital for good reason, but also it makes it more complicated for us to see what's going on. And it feeds into what you're talking about, which is this disbelief that it's actually a thing.
Mm-hmm. Actually, just before this call, a good friend of mine who's a pulmonary PA, she sent me a picture of what she's wearing today. And I'll tell you that it was scary. This is what she has to wear. Not only is she wearing, the face shield, and she's covered in, wearing like a moon suit, but she also had a breathing apparatus that looked out of some sort of sci-fi movie. And I thought, I don't think people get it. I mean, I sort of wanted to I just wanted to post her picture everywhere. I'd be like, this is what she has to wear to protect herself from this horrible virus.
Yeah. And we often see images of the protection that people are wearing, or you see the B-roll from the hospitals where people are kind of calmly, I don't know, like doing this or that. But behind that, there are moments of grief, and there are moments of stress that are really immense. And we're such a visual society right now. We're such a society that kind of like, if you don't Instagram it, it didn't happen.
Right.
And so I think we have lost our ability to imagine what we're not seeing. And that's putting us at risk.
Right. And we can't even go to a funeral. So when someone dies, we can't even, that's sort of a way that we see it with our eyes, and we can't even go to a funeral.
Exactly.
Now. So I'm curious, going forward, what's the near-term future going to look like in terms of communicating about the pandemic?
Well, I think that in the really, really near term for the winter, it's going to be a tough winter. And I was saying this in July, actually. I was like, everyone is hoping this would be a seasonal thing, but they didn't understand the downside of that, which is, if it's seasonal in the winter, it's going to be really tough. So I think that the communication has to be strong in terms of explaining to people why we need to take care not to gather too much inside with folks, or avoid it at all if possible. And then what happens is, hopefully in the spring we'll get a little relief. People will get to be outdoors again and safely at a distance, leading in, of course, to the big change that will happen, which is the rollout of the vaccine, which is already kind of starting here or there. I know the UK has something that's gotten going. And what's going to be the main science communication challenge and public health challenge is explaining to people, we're all going to be in different situations with regards to the vaccine. How do we interact, and how do we give a public message that resonates when people might be getting different versions or different vaccine versions? And, it's going to be a lot for public health officials to relay all the nuances to people. And I think that that's something they should brace for.
Mm-hmm. And what types of nuances do you envision?
Well, like if, let's say you get a vaccine, but you didn't get your booster shot yet. Should we hang out if I'm immunocompromised? Or should you go to the grocery store with a mask or without a mask after your 2 shots? I think that, how are we we're having a hard enough time policing mask wearing where nobody has a vaccine. What's going to happen when some people have a vaccine and say, look, I got my vaccine, I don't want to wear a mask anymore? How do we verify that? And how do we know it's safe for them, and when exactly? I think it's a lot of questions like that.
Mm-hmm. And before then, it's going to be a long and hard winter.
It's going to be a long and hard winter. I mean, I feel fortunate I'm here where it snows a lot, and I cross-country ski and I skate and I snowshoe. So my therapy is going outside as much as when I'm not in front of a computer thinking about the words COVID-19 or SARS-CoV-2. I'm definitely outside in the snow. But that being said, yeah, it's going to suck. It's going to suck.
Well, and on that upbeat note, Roxanne, thank you so much for joining me.
Thank you, Stephanie. And I do want to say that it's going to make every other holiday for the rest of our lives feel so good. So that's a happy note to think on.
Excellent. Thank you.
Public Health on Call is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Spencer Greer, Niall Owen McCusker, C.N. Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo and Neiman Outland. Social media support from Brenda Haggader, Grace Holes Fernandez, and Caroline Wong. Thank you for listening.